Dr. Chidebele Ojukwu, your women's health physiotherapist, founder preggiesandmamas.com. Today I have Jimmy in the house. It's World Breastfeeding Week 2020 and I'm so excited about that. The theme for this year's celebration is Support Breastfeeding for a Healthier Planet. And some lady asked me yesterday, what's the fuse about supporting women to breastfeed? Have they not been getting the necessary support they needed? I said, oh yes, everyone has been advocating breastfeeding, but not every woman has been getting the necessary support to breastfeed properly. Just last week, I encountered 3 women who practically quit breastfeeding because they were experiencing some sort of neck pain, upper back, arm and shoulder pain. You can imagine. For some, these pains last beyond the postpartum period. Similarly, we've encountered children or infants who get off the breast too quickly during a breastfeeding session. And the common misconception is that, oh, they are fully fed. What made you think they are fully fed? Sometimes they may be experiencing some sort of pain or discomfort equally, and they may just have to get off the breast. And what may be responsible for these pains and discomfort in babies and mamas during breastfeeding? Have you thought about wrong breastfeeding positions? It's a common cause of breastfeeding related pain and discomfort. As much as breastfeeding is fun, it can be a scare if you perform it wrongly. So, to support women, I am going to be sharing some tips in this video that will help you choose the right positions during breastfeeding to prevent pain in mama and baby. For the infant, always put your baby on the side during breastfeeding. Your baby should face you. We call it tummy to tummy position. Baby's tummy to mama's tummy, or some call it tummy to mommy position. Avoid placing him on his back while bending his neck towards the breast. This position strains the neck muscles and may prevent him from feeding for a long time. You should also ensure that while he's on sideline feeding, the ear, shoulder and hip should be in alignment on a straight line. Your baby shouldn't be curved like a bean during feeding. If he's curved this way, this can result to pain and deformities. So for you mama, if you're going to be breastfeeding from a sitting position, always make sure you sit in a comfortable chair with appropriate arm supports and back supports. This back support enables you to rest your back on the support. That way you support your back to prevent back pain. To ensure that your back is resting on this support, move your buttocks closer. Your buttocks should touch this back support. That way your entire back rests on it. While resting your back, avoid having gaps or hollows between your lower back and the back support. If there is any hollow between your lower back and the support, use a lumbar roll, insert a lumbar roll. There's actually no specific size for this lumbar roll. It depends on the gap you want to close up. You can fold a thicker roll or a lighter roll. In some other cases, you can use a small pillow in between the back and the back support. Your upper back should always be on the back rest or the back support. If your upper back is off the back support, that means you are probably hunching forward towards your baby. And once your shoulders are rounded, then you are hunching forward and will likely experience neck pain, upper back pain, shoulder pain, or even lower back pain. So ensure to always be in a comfortable sitting position while breastfeeding. So what about the lower limbs? Should they be cared for during breastfeeding? Oh yes, as important as the back too. The commonest thing women do during breastfeeding is to tiptoe. Once you tiptoe, your baby comes closer to you, right? But that's wrong. You don't tiptoe while breastfeeding, because if you tiptoe for prolonged periods or for days or weeks or months, you may likely develop knee ankle, leg, or even foot pain. Ideally, your foot should rest flat on a footstool. This way, your knees are slightly higher or at about the same level with your hip. If you don't have a footstool, you can place a stack of books or a small box to serve. Try not to cross your legs or ankles during breastfeeding, as much as it brings your baby closer to you, but this can be dangerous. Avoid this so that you don't stress your ligaments, your lower back, your pelvis, and your knees. You definitely want your baby closer to the breast while breastfeeding, right? Now, how do you do that? Take your baby to the breast and not breast to the baby. If you take your breast to the baby, you must have to slouch forward for the breast to get to the baby, and this is very wrong. To bring your baby closer to the breast, you can use a breastfeeding pillow. This is a breastfeeding pillow. This pillow comes in different sizes. You have thicker ones and thinner ones. If you are nursing a newborn or a smaller baby, you can use the thicker pillow to bring your baby closer to the breast. If you are nursing an older or bigger baby, you can use a thin pillow to still get the baby closer to the breast. It's important to consider the size of the pillow. If your pillow is too thin for the size of the baby, that means the baby will be lower down on your laps, and this will prompt you to slouch forward. If the pillow is too thick, that means the baby will be higher than the breast, and this is not going to be comfortable for you and the baby. If you are using a breastfeeding pillow, it doesn't just save you the stress of slouching forward, straining your back, your neck, it also saves your upper limb some stress, because you can actually support the baby on the pillow alone while breastfeeding. This is very important if you are nursing a heavy baby. In the absence of a breastfeeding pillow, you can use a sleeping pillow or a roll of cloth to support your baby on your laps. As long as it's comfortable for you and your baby, you can use that. Using pillows will also reduce the extent of neck flexion while you are trying to gaze at your little one during breastfeeding. It puts your neck this way. You may want to breastfeed sitting on a low stool or floor. If you have to do this, then move closer to the wall and rest your back on it. Avoid breastfeeding from the edge of the bed or sitting in bed without supporting your back, this way or that way. Draw closer to the end of the bed to enable you support your back. Always support your lower back while doing this by using a lumbar or a sleeping pillow. The pillow shouldn't be too thick to prevent slouching forward. If your bed has no back support, then you may consider changing room arrangements by moving your bed closer to the wall. In this case, the wall acts as your back support while nursing your baby. This is a reclined position and it's sometimes comfortable, especially when you are nursing a smaller baby. This puts you in between a sitting and supine lying position, meaning you are neither lying on your back entirely and you are neither sitting down entirely. Don't forget to place pillows from the head down to the back for maximum support and safety. Do you think I have forgotten a lovable position for weak to sit mamas? No, I haven't. And that's the side lying position. While breastfeeding from a side lying position, it's advisable that you put a pillow or pillows below your head and shoulder for maximum support. You can put another pillow between your knees, and always ensure that you bend your knees rather than straightening them out. This way, you save your low back some stress. Avoid curving your back while lying down. Ensure that the shoulder, back, and hip are in a straight line. Alternate breastfeeding positions and nursing breasts between feeds to avoid prolonged use of a particular position. By doing so, you prevent muscle shortening as well as reduce your painful episodes during feeding. For instance, you may nurse from the left breast during this feed. In the next feed, you alternate to the other breast. This also applies to switching breastfeeding positions between feeding sessions. It's usually helpful to do some mild stretches during or after feeding. In another video, I'll share some useful stretches that you can adopt during or after feeding your baby to prevent muscle shortening, pain, and discomfort. Now that we have run through these detailed tips, I'm sure you would like to try them out. By so doing, you are reducing your risk of developing breastfeeding related pain and discomfort. Remember, you're not being selfish by protecting yourself during breastfeeding. You care for yourself and you care for your baby. So have a fun-filled breastfeeding experience. To get more of my videos, subscribe to my channel, like, and comment in the section below.